Many of the exercises that we're going to do will work equally well with a set of handles, but the reason we like the bar, and the reason we're talking about the bar today, is the extra sense of security and the confidence that people get having their hand on the same plane, on the same device. Danielle's going to help us do a deep squat here, and it's going to be an assisted deep squat. That's one of the things I think that the Kaiser and the bar blend perfectly together. When we're doing corrective movement and movement prep, if she were going to have a squat workout today, or if she were doing some knee rehab, from, say, a problem, hip rehab or ankle rehab, we'd be looking at the deep squat pattern. Come on back up. Now, one of the reasons we keep the arms overhead in a deep squat pattern is simply to stabilize the core. Being able to deep squat with arms overhead is an unbelievably stressful movement on the spine, but is also an amazing core stabilizer. Do a few more of those for us. Now, let's say she had a problem getting all the way down. She wasn't getting the depth out of that squat. One of the first things we do, and we talk about it all the time, we'd insert a heel lift. We would also have her abduct her knees and try to stabilize. Now, we can use Kaiser and adjust the tension on this to give her more assistance or less assistance. The more resistance we actually put on here, the more assistance she gets. And so it's almost a reverse way of looking at things. So she's going to continue doing the deep squat. We're going to adjust the tension. Watch her hands on the bar and up and down. Now, we can turn this into a resisted squat, and we'll talk about that later, but what I want you to appreciate is how somebody can get confidence in the deep squat and do multiple reps and motor learning in a deep squat pattern just with some assistance. And these two pieces of equipment blend perfectly to allow that to happen. It's very important to go through full range of motion in the deep squat. It's important for the core, it's important for the knees, the hips, and the ankles. And if you need a heel lift, go ahead and use however much heel lift you need for the overhead squat, the assisted squat, or what we're getting ready to show you right now. Now, a heel lift starting at 2 inches can be diminished to 1 inch and a half inch and tapered away, and hopefully people won't be squatting with a heel lift soon. A couple of the problems we notice when we go to the weight room and watch people squat, especially doing a back or a front squat with loaded weight, are we notice a rotation through the torso, or we actually notice a slide in the hips. People will shift all their weight to one side of their body so they look about 60-40, or you'll see a shoulder come forward or a shoulder go back. Now, we've created some corrective exercise and some movement prep to sort of counter that. Now, of course, we hope you've gone through all your mobility and your core training stuff first, but sometimes you need to put some finishing touches. You need to polish that squat just a little bit. Reactive neuromuscular training is the science of teaching people how to move better without coaching them. They need to feel the mistake, and in feeling that mistake, they will actually correct it at proprioceptive level. Our research has shown us that is probably the best way to do it. So what we're going to show you now is 2 forms of squat RNT. The first form of squat RNT is going to correct rotation. The second is going to correct the lateral weight shift. Now for this, we're going to want to move the arm of the functional trainer all the way down to just below waist level. So I'm going to bring that down. And Lee is just going to put the bar in a comfortable back squat position. There doesn't need to be a lot of weight here. This is not a resistance activity. I'm not doing this for hypertrophy or sets or reps. I'm doing this to clean up movement. What I'd like to do is load him just enough to correct his movement. And as he gets better, more proficient, I take away the load so he needs less and less input to do the correct movement. Now, as you notice, I'm using the stick, but it's not attached to both sides as it was for Danielle with the assisted. It's only on one side. So if he steps around and faces the bar, the source where the pulley's coming from, what you're going to see is he's got a significant amount of rotation really spinning him off. My one verbal cue, don't let this pull you off your squat. You do a straight squat regardless of what this is doing to you, and go ahead deep. If he couldn't break parallel here, we'd have some heel lifts in there because I want him to go through the full range of motion. Now, Lee is having to do a whole lot of things, and people like to break this down. Well, is he firing his glute medius, his torso, the obliques, the transverse more? He's doing exactly what he needs to do to clean this up. And when we're adjusting this in the clinic with tubing or right here with the functional trainer, we'll take the resistance up or down simply to clean up the movement. When we see the squat we want, we stop it right there, we do reps, we take off a little bit and keep doing it until the squat is clean. Now, if you see that shift, we're going to fix it the same way, but Lee's going to face me this time, so he has a lateral weight shift. The key here is getting the bar in a comfortable position and setting that pulley at waist level. That way it communicates to Lee the entire time, you're leaning too far left, do something to correct it. So really, in a nutshell, the essence of RNT is exaggerating the mistake you just saw in clean movement. The functional trainer fits that perfectly. The stick gives them a perspective of what they're going to go when they go back into the squat rack. You'll see that. And once again, Do what you got to do to keep that bar level. Don't let it pull you left. Squat right in the center. And in doing that, he's going to appropriately address the adductor on one side, the abductor on the other, the obliques and what they're doing, as well as communicate appropriate posture throughout. We've published a lot of stuff on reactive neuromuscular training, but these are two techniques with the functional trainer and the stick that we use to clean that up. Once you've done your mobility work, your assisted work, and some of the RNT stuff that we do to correct the rotation or the weight shift one way, you can start loading the squat. And this is a very safe and effective way to load the squat with a straight bar, but not in the weight rack. Now, I've done 3 things here to help Danielle with the front squat. Number 1 is the heel lift. The heel lift is going to allow her to go through a full range of motion with just a little bit of an anterior weight shift. That makes the squat easier. Now, if she goes ahead and loads the bar, put it in front squat position, the further she backs up from the functional trainer, that's going to pull her forward too. So that's a form of assistance. Anytime the weight's not pulling you straight down but also pulling you forward, you can sit back into your squat a little bit. And that's assistance. That's a little bit of a give me with the squat, but we do that in early training. Lastly, watch her go through the full range of motion. These cables are loaded here, but at the bottom they're not loaded. Watch her do a few reps and see how the load is basically in the upper third of her squat. The lower third of her squat really isn't loaded at all. Go down and just show them. There's nothing on this bar right here, so she's not really loading heavy at the bottom, but she's starting to explore full range of motion and starting to have to kick in the glutes, the core, the quads, coming up out of the squat. Come on back up. Now, in free weights, they do this with a log chain. They'll wrap a log chain in free weights, and basically as the chain accumulates on the ground, that reduces the weight at the bottom. It's reloaded at the top. We've simulated the same thing with a functional trainer in a very safe and effective environment. Now notice, we've dropped the arms of the functional trainer. She's going to be loaded throughout the entire squat, resistance top and bottom. We've taken away the heel lift, but we're still giving her that anterior weight shift. We only like to remove one of these things at a time, so now we're doing some training. Go ahead and give us a couple of squats right there. This really facilitates a proper hand position without overloading the wrist with the kind of free weight it's going to take to stimulate her legs. So we can get the same mechanics of the front squat, the same benefits of the front squat, without really loading the upper body. Now step forward a little bit. Now, as we just change the angle of that cable from less of an anterior pull to more of a vertical pull, she's loading the legs more, and she's getting less assistance. She can't sit back into this squat. She'll fall backwards. So let's do another squat right here. Get right under it and come right back up out. Good. And the farther she moves in line with these pulleys, the more of a load that she's going to get, almost simulating free weights without some of that extra tension through the upper body. We really like the front squat. I don't do a lot of back squats with this. I really like the front squat once it's time to load. We use the back squat to communicate, to do the RNT, but we really like the front squat when it's time to train. The chop exercise is one of 2 we use, the chop and the lift, and we're going to start with the chop. Down and across the body in a diagonal fashion. We're going to do it both to the left and right side, but one of the quickest ways to check the core for people in a squat position is go ahead and watch the chop movement right here. Now he's in a symmetrical knee position. Both knees are down, so we're looking at the hips and the way the core interacts when the hips are doing the same thing as opposed to the lunge when they're doing opposite things. So I'm going to give Lee a few cues. First of all, start at the very top, reach, stay tall. Press your head up into my hand, that's transverse abdominis coming on, and chop down and across and finish the move. All the way down and across. Good. Now it's a pull to a push. He starts it with this arm, he finishes it with that arm. The cable stays in line with his arm the entire time. Now we're going to do this for sets and reps. Thanks. But a neat thing about Kaiser is we can actually check power as well. In the past we had to count sets and reps and do a rep out. See where he started to falter in the middle of a set. So we could count maybe a 15 rep max on one side, 8 rep max on the other. We could calculate a deficit in the core for the squat from that test. We can now check power, Kaiser, without velocity or anything. We can pull it as hard as we want and it'll rate power. And sometimes we can go back and look at the core that way too. So if you're checking the core for the squat movement pattern, both knees in the same position, symmetrical hip position, execute the chop both left and right, look at differences. Anything greater than 10 or 15%, you want to fix that. Danielle's going to demonstrate a lift here, and she's going to pull up and across her body, whereas Lee was going down and across his body. Still in a symmetrical hip position or both knees down, tall kneeling. Now, people are going to have a tendency to want to kick in those hip flexors. You're going to see them do that when they stick their butt out and try to do this all with their triceps and muscle through the move. Secondly, we're not looking for a big torso turn here. The execution of the exercise should occur almost totally with the arms. If the arms are moving, then the core's got to be stable and the hips have to be stable. So a couple of things. We want to press up through the spine. Head is tall, stay on my hand the whole time. We're going to pull to a punch, or pull into position and punch. Go ahead and show us one of those. In a position, and nice and slow, up and through. Back down. Now, get your rhythm and just do a few. Stay tall, and back down. Stay tall, stay tall, stay tall. Back down. Good. All right. You probably also notice a floor grid we're using here, and basically getting Danielle in the right position was all about finding that angle, and I want to be able to reproduce that if I'm doing chop and lift stuff. So whether you're taping the floor, you find a grid or something like that, it's really good. If you're being selectorized here, if you're using a consistent hand position on the stick, you definitely need to get that for your foot position or knee position on the floor.